According to the National Multiple Sclerosis Society, worldwide, more than 2.3 million people have a diagnosis of MS. Today, we're joined by Dr. Jason Silverstein, the director of ChristianaCare's Comprehensive Multiple Sclerosis Center, to discuss this chronic and unpredictable disease. Dr. Silverstein, thank you for joining us. Please take a minute to introduce yourself.
Hi, thank you for having me. So I am the director of our Comprehensive Multiple Sclerosis Center here at ChristianaCare. In addition, I'm the clinical leader for our outpatient neurosciences practice. And I've been here in Delaware since 2010.
Now, let's start big picture. What is the definition of multiple sclerosis?
So multiple sclerosis is still thought to be what we call an autoimmune disease. We believe at some point early on in life, there's some trigger that leads to immune system dysfunction. The immune system is supposed to protect self, and at some point, there's a loss of tolerance, and the immune system ends up attacking nerves in the brain, spinal cord, or even the optic nerves for vision. Depending on where this injury occurs or this inflammation occurs, dictates the symptoms that people may have.
Some people may hear that and still be confused about what exactly causes MS.
Yeah, it's a great question, and one we receive at almost every new patient appointment. The honest answer and short answer is we still don't know for sure what the potential singular cause of multiple sclerosis is. That said, we believe that in genetically predisposed individuals, there is some environmental trigger that leads to them developing an immune system dysfunction, thus MS. Now, what those triggers are is debatable. They range from things like low sunlight and low vitamin D to potential nutritional changes or dietary considerations to potentially viral infections. And in fact, a recent study out of Harvard in the past few months further shed light on the relationship between the Epstein-Barr virus and multiple sclerosis. A very good study showing a strong association that if you've been exposed to Epstein-Barr virus, your risk of multiple sclerosis is significantly higher.
And what are the signs and symptoms people should be looking for when it comes to MS?
So MS can cause varied symptoms depending on where inflammation occurs within the brain or spinal cord. Some common symptoms, at least the most common that people present with, is what we call optic neuritis with their first event. And that includes a vision loss, typically in one eye, a blurring of that vision. Other symptoms can include numbness, tingling, feeling of weakness or heaviness of a limb, off balance, and sometimes, doubling of their vision. These symptoms typically come on over 24 hours. They're constant, get worse over about 48 to 72 hours, and then they level off and can take anywhere from days to months to improve, and recovery is, sometimes complete and sometimes it's partial.
You mentioned everyone is different and every case is different, but generally speaking, how does that diagnosis progress over time?
That's a good question. So MS is an extremely variable illness. It is a bit different person to person. In general, there's two subtypes of MS. The most common are people that are relapsing remitting. And what that means is they have attacks or relapses, which are new neurological symptoms. And in between attacks, there's what we call remission, where nothing new is happening. They may still be having symptoms from previous attacks, but there's no new outward problems that are happening. And that's most people that are in this relapsing remitting phase. And the disability or the physical problems or cognitive problems that people have stem from the attacks that happen themselves that they don't recover from. Whereas as people are 15 to 20 years into their diagnosis, there are individuals, not everyone, but there are people who enter what we call the progressive phase of the disease, where disability that they've already accrued over time, let's say a weak leg, begins to slowly and continuously worsen over time. So the disease certainly can become progressive in nature, but to emphasize, that is not everybody. That's a subset of individuals.
What kind of treatment is available, especially as you mentioned, everyone is so different? So is there a standard treatment then?
So there are two sides to treatment for multiple sclerosis. The first side, of course, is our disease modifying therapies, or we call DMTs. And those are our FDA approved medicines, of which we have over 18 now for relapsing remitting MS. And we do have one approved therapy for primary progressive MS. Those are individuals that are progressive from the get-go. They've never actually had a relapse. So we have these therapies that are available that are meant to control the immune system in various ways and to prevent tissue injury, prevent inflammation in the brain or spinal cord, keep the person stable, prevent attacks, and ultimately try to prevent them from accruing disability over time. The other side of treatment is what we call symptomatic therapy or symptomatic treatment. So our DMTs are not meant to make people feel better. They're preventative in nature. But when it comes to managing things like fatigue and cognitive dysfunction and pain and bladder issues, we employ strategies to manage these symptoms, either using medications or referring them out to specialists in the community for a more comprehensive approach.
You know, someone watching may have just been diagnosed or have a family member who was diagnosed. What advice do you have for them?
First step most times is to take a deep breath. There is some misinformation out there about MS, and many people are biased in what they know about MS, in that the only thing they may know is they have an uncle who had it and he was really bad. And so the first step is to take that deep breath, realize that the disease is manageable and treatable. And I definitely recommend that people after diagnosis try to see an MS specialist to make sure that the treatment plan that's being recommended or being initiated makes sense for that individual and is paired up appropriately with their disease severity. After that's done, I mean, I always tell people the most important thing is to focus on what I call foundational health. And those are three pillars of foundational health, and that is exercise, nutrition, and then of course, mental health. And it's really important to begin to work on these three pillars to achieve the best health status possible, since a number of these processes help to reduce inflammation within the body and manage levels of stress.
And how do we help MS patients here at ChristianaCare?
So ChristianaCare, I've been with ChristianaCare since 2010. We've been a comprehensive center of excellence since 2016, as designated through the National Multiple Sclerosis Society. Since that time, we have been providing comprehensive, coordinated care for our patients in the community. We do this with a team approach. We have a full-time physician assistant who's MS certified that assists me in the care of these patients. We also have a full-time MS certified nurse who is at the core of the MS Center and helps to coordinate all the medical care needed. And then we have a social worker, a full-time social worker that is crucial in coordinating a lot of the non-medical care that these complex patients need, such as transportation, financial issues, and access to medications. We're unique in that, you know, this team has been together for 8 years. So it's a strong core. In addition, we have some unique things in our MS Center. So we have an embedded psychologist or behavioral health to help patients with health-related mood issues. We also have an embedded specialty pharmacy within our clinic to help patients with access to their expensive specialty therapies. And lastly, which I'm excited about, in this next fiscal year, we'll be looking to institute what I call multidisciplinary clinics. So that's a monthly clinic where complex patients with various needs will come and see multiple disciplines in one day, such as speech, nutrition, physical and occupational therapy, along with the physician and social work, to coordinate that complex care in one setting, in one place, which is really a value add for our patients and ultimately to improve the quality and reduce the risk of hospitalizations.
What is the most important thing you want viewers to take away from this conversation about MS?
Probably the most important thing is, like I said before, is to recognize this condition is quite variable. People should avoid trying to compare themselves to somebody else with MS. It really is individualized. And it's very important to establish, you know, a relationship with a healthcare provider. It doesn't always have to be an MS specialist, but it has to be a neurologist that you trust, that there's open communication, that you feel heard. And that way you can make sure you're doing everything you need to do for your condition.
Dr. Silverstein, thank you so much for your time and your work with MS. This was a very valuable conversation. Take care.